Imagine getting a tiny, just a microscopic injection in your mouth to help your gums heal. And then 24 hours later, your liver is sending out systemic distress signals.
Right.
That is exactly what happens when the biological math of these so-called vampire treatments goes wrong. You often hear about these procedures, right? Like they draw some blood, spin it in a machine, inject it back in, and supposedly your tissues are just instantly rejuvenated.
Yeah, it sounds like magic.
Right, it sounds like magic. But
Yeah.
when you look closely at the science, it's not magic at all.
No, not even a little bit. It's an incredibly precise biological equation. And the margin for error in that math is, well, it's incredibly slim.
Mhm.
If a provider injects, the wrong formulation of your own blood into delicate tissues, you don't get the rejuvenation.
Wow.
You actually trigger severe pain, localized tissue damage, and like you just mentioned with the liver, systemic inflammation that just echoes throughout your entire body.
Which honestly brings a lot of urgency to our mission for this deep dive today.
Yeah.
We are looking at a very specific, highly popular procedure known as the O-shot. And we're asking a hyper-focused question for you. What is the exact optimal hematocrit or red blood cell level in leukocyte-poor PRP to prevent submucosal tissue inflammation?
Yeah, and I know that sounds like a mouthful.
It really does.
But for anyone, considering a regenerative treatment, this is the exact science you need to understand to protect yourself. Taking blood out of your arm and just throwing it into a centrifuge doesn't automatically create a healing serum.
Right.
The physical settings on that centrifuge and the specific microscopic layers of blood that are extracted, they completely change the biological drug you're manufacturing right there in that clinic.
Okay, let's unpack this. Because to get to the bottom of this, we've pulled together a massive stack of sources for you. We're looking at, orthopedic journals, clinical trials on submucosal injections, deep dive analyses of specific medical centrifuge systems like the XL and the leukocyte-poor PRP and, general guidelines on regenerative medicine. But before we get into the exact blood metrics and the red blood cells, I always hear the term O-shot tossed around in wellness clinics. What is actually happening mechanically?
So the O-shot is a trademarked procedure that utilizes platelet-rich plasma, or PRP, specifically to rejuvenate female erectile tissues.
Okay.
We're talking about the delicate tissues of the clitoris and the vaginal wall. Clinicians use it to address some really difficult quality of life issues.
Like what?
Things like dyspareunia, which is painful intercourse, as well as urinary incontinence and decreased sexual sensitivity.
Okay, so I'm tracking with the goals of the procedure, but how do we get from a vial of, whole blood to this rejuvenating serum? What is actually happening inside that machine?
Right. Well, it comes down to physics and density.
Okay.
Your blood is mostly liquid, that's the plasma.
Okay.
But suspended in that clear liquid are solid components. You've got red blood cells, white blood cells, and platelets. And the goal of PRP therapy is to draw your whole blood and use centrifugal force to separate it into distinct layers.
Basically just spinning it really fast.
Exactly. When you spin the blood at high speeds, the heaviest elements, which are the red blood cells, they sink to the very bottom of the tube. The lightest element, the plasma, floats to the top. And right in the middle, you get this very thin layer containing the white blood cells and the platelets.
That makes sense. We are trying to isolate the platelets.
Mhm.
And I remember reading in the sources that platelets are just these fascinating little structures.
They're amazing.
Right. Normally they just look like these inactive discs floating around in your bloodstream. But when they're activated, which I think is usually by tissue trauma or degeneration,
Yeah.
they physically change shape. The text described them as sprouting these octopus-like tentacles so they could reach out and, attach themselves to the damaged area.
Yeah, those tentacles are crucial for anchoring to the site of an injury. And once they anchor, they degranulate, which basically means they release this massive payload of growth factors.
Wow.
We're talking about platelet-derived growth factor, vascular endothelial growth factor, transforming growth
What are
factor.
the factors?
It is. And these proteins act like biological foremen, basically signaling your body to build new blood vessels, produce collagen, and regenerate healthy tissue.
If I've ever had a bad scrape, I've noticed that. Clear, yellowish fluid that forms around the scab as it heals. That yellow goo is essentially my body's own natural platelet-rich plasma doing its job,
Yeah,
right?
pretty much.
So the O-shot is just concentrating that healing fluid and putting it exactly where it's needed to revive those delicate tissues.
That is the intended mechanism. But there is a significant catch in the extraction process.
Oh.
Yeah. While you want those platelets, they don't travel alone in your bloodstream. In that middle layer of the centrifuge tube we talked about, the platelets are packed in tightly with white blood cells.
The immune system's bodyguards.
Yes, the leukocytes. And this is the first major fork in the road for PRP preparation. While platelets are universally great for healing, those leukocyte bodyguards aren't always helpful, especially when you are injecting them into highly delicate tissue.
Right, they can be a bit aggressive.
Exactly. When you spin blood, the white blood cells settle into a very concentrated microscopic band called the buffy coat, and the most abundant type of white blood cell in that buffy coat is the neutrophil.
Okay, but I generally think of white blood cells as the good guys. I mean, we
Mhm.
want them to fight off foreign invaders and keep us from getting sick, right?
Oh, we rely on them for fighting infection, absolutely. But neutrophils are your immune system's aggressive first responders, and their methods are entirely destructive.
Destructive how?
Well, their primary job is to engulf and destroy foreign material. When they go to work, they release reactive oxygen species, as well as proteases and inflammatory cytokines like interleukin-1 and TNF-alpha.
Okay, let me stop you there because those are some heavy chemical terms.
Yeah.
What does it actually mean for the tissue when a neutrophil releases a reactive oxygen species?
Think of it as biological bleach.
Oh, wow.
Yeah, the neutrophils don't just target bacteria, they dump this biological bleach onto the site to sterilize it, which causes, collateral damage to all the surrounding cells. They also release chemicals that trigger apoptosis, which is programmed cell death.
That sounds intense.
It is. They basically scorch the earth to clear out any potential threats.
But wait, why in the world would any doctor want to inject biological bleach into the submucosal tissues of the vaginal canal? That just seems like a recipe for absolute disaster.
What's fascinating here is how just changing the spin of a centrifuge completely alters the biological drug you are creating. Some clinicians actually do want that scorched earth response. Yeah, but for entirely different conditions. Like if an orthopedic surgeon is treating chronic tendinopathy, say a stubborn Achilles tendon that has calcified and just stopped healing, they might intentionally use leukocyte-rich PRP.
Oh,
They want to trigger a massive acute inflammatory response to kickstart a stalled healing process in a tough, poorly vascularized tissue.
okay, I see the logic for a tough tendon. But the O-shot is treating tissues that are highly vascularized and incredibly sensitive.
Exactly. And for the O-shot, the clinical sources are emphatic. You need leukocyte-poor PRP.
Right.
You need a centrifuge system that actively excludes that buffy coat layer we talked about. A high-quality LP-PRP system will cut the neutrophil content by 92 to 96% compared to whole blood.
That's a huge reduction.
It has to be. If a provider accidentally uses leukocyte-rich PRP in the O-shot, that excess inflammation can lead to fibrosis.
Fibrosis being scar tissue.
Yes.
So instead of making the tissue more elastic and sensitive, you're literally scarring it. That is the exact opposite of what the patient is paying for.
It defeats the entire purpose of the procedure. So we know we have to navigate away from the white blood cells. But that brings us to the main culprit of our core question today. We need to talk about the heaviest layer at the bottom of the tube, the red blood cells, which are measured clinically as hematocrit.
Hematocrit, okay. That's simply the percentage of your blood volume that is occupied by red blood cells.
Right. And in the context of localized PRP injections, red blood cells are arguably the most dangerous contaminant of all.
See, I'm having a hard time wrapping my head around this. If I go to a med spa, they're drawing my blood. How can my own red blood cells, which are already inside my body keeping me alive, suddenly become a dangerous contaminant just because they were put in a centrifuge?
Well, it comes down to where those cells are located. Inside your veins and arteries, red blood cells are essential for carrying oxygen, but they do not belong in the extracellular space of your tissues.
Okay.
Red blood cells do not contribute to tissue regeneration at all. Worse, when they are injected outside of a blood vessel into a tissue space like the submucosa, they undergo hemolysis.
Meaning they break down.
Right, they physically rupture. When the membrane of a red blood cell bursts in that tissue space, it spills its internal contents, specifically extracellular hemoglobin and free iron, into the surrounding area.
Oh, that doesn't sound good.
It's not. This is where the biological damage initiates. That free iron acts as a powerful catalyst for the formation of hydrogen peroxide in the tissue. It creates massive oxidative stress.
It's essentially causing the cells to rust.
Cellular rust is a brilliant way to conceptualize it. It degrades the tissue structure.
Here's where it gets really interesting, though, because my notes from the sources point out another catastrophic effect of that free extracellular hemoglobin. It actively depletes nitric oxide in the surrounding area.
Yes.
Now, wait a second. Let's think about the mechanics of the O shot. The entire goal is to rejuvenate erectile tissues.
Right.
And the physiological mechanism of arousal in those tissues relies heavily on nitric oxide to cause vasodilation to open up the blood vessels and engorge the tissue with blood.
You are seeing the paradox perfectly. If a provider's PRP is contaminated with red blood cells, the free hemoglobin scavenges and depletes the local nitric oxide. And when nitric oxide drops, you get vasoconstriction.
The vessels close up.
Exactly. The blood vessels tighten up and restrict flow.
So a poorly prepared O-shot, like one with a high hematocrit level, literally sabotages its own primary goal. You're injecting a serum to increase blood flow, but the red blood cells you accidentally included are chemically forcing the blood vessels to clamp shut.
It actively works against the treatment. Furthermore, from a purely practical standpoint for the patient on the table, the clinical texts highlight another really unfortunate detail. High hematocrit makes the PRP physically thicker. It drastically increases the viscosity of the fluid.
Meaning it's harder for the doctor to push it through the syringe.
Exactly. And because it's thicker, the submucosal injection itself is significantly more painful for the patient. You're basically forcing a thick inflammatory sludge into a highly sensitive, confined tissue space. The pressure alone causes acute distress.
Wow. Okay, so we've established that red blood cells are terrible for this application. They cause oxidative stress and cellular rust, they deplete nitric oxide, causing vasoconstriction, and they turn the injection into an agonizing sludge.
Yep.
Now we have to answer the ultimate question of this deep dive. What is the optimal hematocrit number? And what actually happens systemically if a provider just ignores this math?
To understand the stakes, we need to look at a specific clinical study detailed in our sources regarding submucosal injections of PRP. It's the bimaxillary protrusion study.
Wait, what exactly is bimaxillary protrusion and why are we looking at it for an O-shot deep dive?
Fair question. Bimaxillary protrusion involves an orthodontic procedure where the teeth and jaws are repositioned, and in this study, PRP was injected submucosally in the mouth to aid healing.
Okay, the mouth.
Right, but the tissue types of mucosal tissue is the key link here. The mucosal lining of the mouth is highly vascularized and structurally very similar to the submucosal tissue of the vaginal canal.
Oh, I see.
It provides a direct window into how this specific delicate tissue layer reacts to a PRP injection.
And according to the hook we started the show with, the results were pretty alarming.
Very alarming. The researchers tracked the patient's blood inflammatory markers 24 hours and 7 days after the localized submucosal PRP injection. They found significant systemic alterations in the patient's blood work.
From a mouth injection.
Yeah. Even though the injection was small and highly localized to the mouth, it tripped inflammatory alarms throughout the entire body.
Okay, let's break down those alarms. What markers were spiking?
The study specifically highlighted liver function markers. Gamma-GT, alkaline phosphatase, and total protein levels were all significantly altered.
Gamma-GT. I mean, that is essentially an alarm bell your liver rings when it is under toxic stress, isn't it?
Yes, exactly.
The fact that a tiny injection in the mucosal tissue is making the liver ring that bell shows just how systemic this localized treatment really is.
The data paints a clear picture. The submucosal tissue is highly vascular and extremely reactive. If you inject a highly inflammatory red blood cell-rich mixture into it, the damage doesn't just stay local. The oxidative stress and the inflammatory cytokines enter the bloodstream and induce a systemic inflammatory response that forces vital organs like the liver to react.
That is just wild. It really drives home the point that PRP is not just a casual beauty treatment where they rub a little bit of your own blood on you.
Not at all.
When injected, it is a potent, active biological drug. So what is the exact number? To avoid spiking our liver enzymes, to avoid the vasoconstriction and the cellular rust, what hematocrit percentage do we actually need to hit?
Based on the data from top-tier clinical centrifugation kits, the optimal hematocrit level in leukocyte-poor PRP is as close to 0% as physically possible.
Absolute purity, 0% red blood cells.
For example, the Hemocyte Pure PRP system, which was heavily analyzed in the source documents, lists its final hematocrit at strictly under 0%. It is effectively near zero. Data from another highly rated system, the XL 60 milliliter kit, shows they consistently reduce the hematocrit to an optimal 1.99%. And they managed to do that without sacrificing the platelet yield.
Yeah, notice the sources also mentioned a benchmark from another study showing that diluting a 7% hematocrit down to 2% was necessary for safe application. So the scientific threshold we are looking for is strictly under 2%, ideally approaching absolute zero.
This raises an important question, though. How is a patient supposed to know what their provider is actually injecting into them?
That is the terrifying part. You're lying on the clinic table, they come in with a syringe, and, just looks like pink or yellow fluid. I certainly can't eyeball a 1.99% haematocrit from across the room.
Nobody can, which means the patient must step up and be their own advocate. They have to ask their provider for the math before the needle ever gets near them. Dr. Dawn Buford, a leading voice in orthopedic regenerative medicine, outlined 15 specific data points that should be used to evaluate the quality of a PRP preparation.
15.
Yeah, patients don't necessarily need to memorize all 15, but they must understand the core tenets of what makes the drug effective versus toxic.
So if I'm a patient walking into a clinic tomorrow, what specific questions should I be asking the person holding the syringe?
You should ask, what is the platelet dose? According to the guidelines, patients should be aiming for a dose of at least 4 billion platelets per injection to ensure efficacy.
Okay, 4 billion.
Then you must ask, is this leukocyte-poor and is the hematocrit under 2%? If the provider just waves their hand and says, oh, we just spin it in the machine we bought, and they cannot answer those specific questions with hard data from their centrifuge manufacturer, the patient should immediately walk away.
Wow. So what does this all mean? It means that a med spa or a wellness clinic can't just buy a discount centrifuge off the internet, draw some blood, and start offering the O shot.
Absolutely not.
Or at least they shouldn't. They must understand the strict, unforgiving science of cellular density. They have to know how to navigate the buffy coat to eliminate those inflammatory neutrophils that act like biological bleach. And they have to get that hematocrit down below 2% to prevent both local tissue sabotage and massive systemic inflammation.
When prepared correctly with near zero red blood cells and low leukocytes, the O-shot is a highly effective, elegant use of the body's own regenerative capabilities. The platelets can anchor to the tissue, release those vital growth factors, and rejuvenate the area without having to fight through a toxic swamp of oxidative stress and scar tissue.
Yeah.
The precision of the preparation dictates the entire outcome.
It all comes back to that biological math we talked about at the beginning. We are taking the yellow goo of healing, carefully separating out the leukocyte bodyguards that cause collateral damage, and entirely removing the red menace that causes rust and vasoconstriction.
Exactly.
And we have to do all of that while keeping at least 4 billion platelets perfectly intact. It's really an incredible feat of microscopic cellular engineering when it's done right.
It is. If we connect this to the bigger picture, though, it leaves us with a rather unsettling realization. We just walked through the rigorous science showing that a tiny, localized submucosal injection of poorly formulated PRP can significantly alter liver enzymes and trigger a systemic inflammatory response.
Just from a little bit of the wrong blood mixture being placed in the wrong tissue space.
Right. Now think about the absolute explosion of the regenerative medicine industry right now. Med spas on every corner are offering PRP for facials, hair restoration, joint injections, and sexual wellness.
Yeah, they're everywhere.
It really makes you wonder, with all these local injections happening every single day across the world, what other silent, systemic inflammatory alarms are being tripped in our bodies, simply because the person operating the centrifuge didn't understand the exact math of our blood?
That is a terrifying and, frankly, entirely necessary question to end on. If you're going to use your blood as medicine, make sure your doctor is a mathematician, not a magician. Let that sink in as you navigate the wild west of regenerative treatments. Keep asking the hard questions, and we'll see you next time.